I would like to acknowledge the traditional custodians of the Wurundjeri people of the lands that I'm speaking to you from today. I also acknowledge the traditional custodians of the lands on which each of you are living, learning, and working from today. As we share our knowledge and teaching and learnings, may we pay respects to elders both past and present. It is their knowledge and experiences that hold the key to the success of future generations.
Good morning and welcome to the National Patient Organisation Network Conference brought to you by the Centre for Community-Driven Research. We wish to acknowledge the traditional custodians of our country throughout Australia and your connections to land, sea and country. And we pay our respects to all elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples in attendance today. My name is Anne Wilson and I'm CEO of Emerge Australia. And for those who do not know what we do, we look after people with myalgic encephalomyelitis, chronic fatigue syndrome. It's a mouthful, I know, and other post-viral conditions such as long COVID. Emerge Australia and members of the MECFS community benefit greatly from the federal government funding through the Patient Pathways program for our case management service, which continues to be booked out with requests for assistance and support, particularly at this time post-pandemic. I'm honoured to be facilitating this first session of the 2022 National Patient Organisation Network Conference. We're delighted to be bringing you this important conference at a critical time in Australia's political history and in fact the world's. For patient organisations in Australia who are at the heart and soul of the health system, it has been a worrying time as a result of a resource sapping pandemic out of which we are still emerging. Our organisations provide linkage between patient organisations and families, government, researchers, clinicians, service providers, policymakers and industry. NPON Australia is a space for patient organisations that work at the grassroots level to come together to develop solutions that work best for their patient populations and lead to systemic change. Our 2022 conference aims primarily to increase awareness of the role and services provided by patient organisations so critical and such an integral part of Australia's healthcare system now and into the future. We also wish to emphasise our unique role as advocates for changes to health policy and practices, particularly at this time. And we wish to learn how patient organisations are perceived by stakeholders and understand where our advocacy issues may sit within the competing priorities that decision makers and governments navigate on a daily basis, especially in these uncertain times. This is particularly so for patient organisations working in disease areas that aren't as well recognised as others. Before commencing, I wish to congratulate Dr. Kate Holliday and her CCDS team on putting this conference together under less than ideal circumstances. Thank you, Kate. This morning, we will be hearing from 3 speakers, each providing us with a different perspective on health, underscoring the immense contribution that patient organisations make to quality of life and the support of their respective stakeholders. Without further ado, I'm delighted to welcome my local member, Dr. Katie Allen, MP, member for Higgins, as our first speaker. Katie is married with 4 children and prior to becoming a member of Parliament was a paediatrician at the Royal Children's Hospital for 28 years, a professor at the University of Melbourne and the University of Manchester, and director of the Australian Centre of Food and Allergy Research. As a supporter of community-driven initiatives, Katie is also a co-convener of the Parliamentary Friends of UNICEF, Parliamentary Friends of Child and Adolescent Health, Parliamentary Friends of Hemochromatosis, Parliamentary Friends of Young People, and Parliamentary Friends of Cancer Care and Cure. She's been a great supporter of patients and patient organisations, and it gives me great pleasure to welcome her to open the National Patient Organisation Network Australia Conference of 2022. Welcome, Katie.
Thank you so very much, Anne. Thank you for that wonderful welcome. And thank you to everyone who is online. And as you mentioned, we've all been dealing with COVID, and it's such a pity that we can't meet in person. Hopefully next year we can. And I know this conference has had to deal with quite a lot to actually get even to this point. So congratulations to Kate and all the organisers for bringing us all together for what is an incredibly important conference. The National Patient Organisation Network Australia has an incredibly vital role. And the reason I say this is not just because I'm here opening the conference, but because it's an absolute fact. I have worked in the system, as Anne mentioned, for 28 years as a paediatrician, and the voice of the patient is so central to all that we do. And I used to say to my fellows and my registrars, we need to be listening, because at the end of the day, it's only those who are patients and families with the actual condition themselves that really understand the issues that they're facing. But most importantly, and particularly in paediatrics, rare diseases and conditions that are less common can be so confusing for families to navigate services and the medicines that they need for themselves, their loved ones and their families. And myself, having worked in an area of gastroenterology and food allergy, where there is a lot of conditions that don't even have names, or genetic conditions that have not yet been identified, it's very, very frightening, confusing, and it's a whole journey for patients and their families as they navigate what can be an incredibly difficult healthcare system to deal with. I think the first thing to say is thank you so much for all that you are doing as a large group of organisations coming together under this national umbrella. It is very important that you continue to persist in your efforts. But I also want to give you a sense of hope. And that hope is that your voice is being heard. And that is true not just here in Australia, but right across the world. Medical researchers and health professionals have heard loud and clear that the role of patient voice needs to be central to everything that we do in the healthcare sector. And now there would be no one who'd write a grant or try to deliver services without engaging in patient voice. And I do believe that government now, both here in Australia and around the world, is hearing that loud and clear. And there are different mechanisms that different governments are activating to make sure that patient voice is central to all that we're doing. And there's a wonderful group of different patient voices that are involved in this particular conference. And I do want to just take a side note to give a shout out to Aussie, which is the Australian eosinophilic esophagitis patient support group, of which I used to be on the medical advisory board. But I know that there's a whole lot of different patient support groups here that I've been involved in, Crohn's and colitis, given lectures to conferences that they've organised, been involved in Mito Foundation, the wonderful work that you have done in advocating for the passage of May's Law through the House of Representatives late last year, and hopefully will pass through the Senate just in a number of weeks. But Genetic Support Network Victoria, Pink Hope, Usher Kids Australia, the Stroke Foundation, Cerebral Palsy Support Network. When we speak about these patient support groups, it really does touch the hearts and lives of so many millions of Australians, whether it's through people who suffer from the conditions themselves or communities that are affected by supporting patients and families with these conditions. So a great shout out to all of you who are working in the sector. And to also say that, having myself been on your side of the table, so to speak, I do want to give you a sense of hope that on my side of the table, your voice is being heard and there is a lot being done. Now, I know that the Patient Pathways program has been a wonderful initiative, and I really do endorse the program and the wonderful work that is being done, because and we see this with lots of different programs, there needs to be a very important front door that is welcoming for patients. When a patient has been identified with a condition, sometimes they don't know who to speak to or who to reach out to. And a patient support group provides that wonderful opportunity. And the Patient Pathways program that the National Patient Organisation Network Australia has funded as a pilot program, I believe is a very, very effective way to give people a pathway into the support, the services, and potentially the medications that they need. So I fully endorse supporting further funding for the PPP, because I think it's incredibly important, efficient, and very easily accessible place for patients to first begin. And I know myself as a doctor, I know that families would be looking for that personal connection of other people who've been through the diseases or the conditions that they are grappling with, who want to know how to access the best services, to be able to talk to someone who has experienced the very journey that they are on. And let's be very clear, the journey takes time, whether it's a condition that is short or long-term, that is acute or chronic, that is life-threatening or not life-threatening. Speaking to somebody who has been through the processes, the journey, the emotions is incredibly important to provide support and hope for people who are sometimes in a head-spinning situation. I wanted to say a very special point about how the sector has been dealing with COVID in the last 2 years. I think we are all finding it's been a very difficult pandemic, but I am proud of the advocacy I have made in my small way to make sure that those with rare diseases in particular, that their voice is not left out of our COVID response. And some of you may know that I wrote an opinion piece with Mike Freelander, who's a Labor paediatrician in New South Wales, about a bipartisan support process to support particularly children with chronic diseases to have quick and prioritised access to the vaccines when they became available, because I know it's very important to ensure particularly some of the comorbidities that children in particular might have, such as obesity or diabetes, put them at greater risk of adverse effects from COVID, or making sure that the rapid antigen tests were available free for those with a concessional card. So those sorts of steps inside the tent, I think, have been important to make sure that your voice as a sector is being heard when we've had our COVID response. And of course, the NDIS, which is our largest social support program in the history of Australia, is being rolled out at speed to literally almost 500,000 people across Australia, is being rolled out in a way that is supportive of the sector, and particularly those with rare conditions are often using the NDIS. So it's a very important partnership program for any health funding that's coming through from the government. So those two great underpinnings for patient support, which include both the health programs that we know Australia has one of the best healthcare systems in the world, but of course we can always do better. But then of course the NDIS, National Disability Insurance Scheme, working hand in glove to do the best that they can for all Australians, but particularly those with rare diseases. Now, I just in my last few minutes want to turn my attention to the Zimmerman report. And for those who haven't read the Zimmerman report, it does make for valuable reading. It's very important for the sector, and particularly for the National Patient Organisation Network Australia, because we heard clearly in this inquiry, it's a bipartisan committee. It's the Health Committee of Parliament, led by Trent Zimmerman, the member for North Sydney. I'm a supplementary member on this committee, and the Zimmerman report was handed down with a list of recommendations, 31 recommendations that are very important for all Australians, I believe, to look at and to digest. But I just wanted to point out a couple of important recommendations. Firstly, that the Australian government establish a Centre for Precision Medicine and Rare Diseases within the Department of Health. And that is to make sure that those with rare diseases are at the heart of our response from a healthcare point of view, because we do recognise that rare diseases can often be a group of very rare conditions brought together, actually represents about 5 to 7% of health conditions. So individually, there may be very rare diseases, but brought together, it's a very substantial number of patients that are being represented by rare diseases. We also asked for establishment of an Office of Clinical Evaluation so that we can make sure that everything we do is evidence-based. We recommended an assessment process for the life-saving drugs program, which I know is very important for the rare diseases community, to be streamlined and delays in access to treatments be reduced by ensuring that a sponsor only need to lodge one application for one health technology assessment pathway. We also recommended that a fund be established to support patients, clinicians and not-for-profit organisations to sponsor registration and reimbursement applications where there is no realistic prospect of a company serving as a sponsor. That's important because sometimes pharmaceutical companies decide they do not have the means to have a drug for a rare condition, and this is an opportunity for patients and clinicians to access these pathways more readily. And we also recommended some significant changes to the orphan drugs program. And then lastly, I wanted to note a very important recommendation that some of you may like to look at more carefully, which is recommendation 28, that the committee recommends that the Department of Health integrate the patient voice upfront into the health technology assessment system. We believe that there should be representation from peak patient bodies that is refreshed every 3 to 5 years, including representation of Aboriginal and Torres Strait Islander peoples. That there should be a notification system for all health technology assessment bodies and the TGA to advise relevant patient groups of the receipt of an application. So there's a whole lot more to that recommendation, but that's about making sure that we have patient support groups representing patient voice and representing improved access to services. But on the other side, that government also ensures that patient voice is at the heart of a health technology response, which means medicines, medical devices, and all of the digital products that are coming online at speed, including improved genetic testing, because we now have better genetic risk profiles that are becoming available so that people who may have a rare disease that has not yet been identified or diagnosed will have better and quicker access so that they have the ability to understand what condition they or their family member has and therefore be able to offer improved services, potentially either a treatment or a cure. All of those sorts of things are about making sure that the patient is at the heart of all that we do, because after all, that is why we do what we do. Lastly, I'd like to sort of make the comment that it can feel very disheartening for patient groups in the sector because, patients are the heart and soul of the system, but there are many players within the system. So there are, of course, government, which I'm here representing, but there are researchers, clinicians, service providers, policymakers, and of course, industry, the form of pharmaceutical, but other forms of industry, medtech companies as well. And so sometimes the patient voice can feel small and not heard. But what I would say is you are incredibly important. You have been heard by government and by the medical research and health care providers. Please do not give up. Having been a medical researcher for my entire medical professional career, and knowing in my sector that there's a very low success rate, I think it's at the moment only 12% of project grants are actually approved and funded, and yet we know that 75% of them are fundable. And I said in my first speech, it's amazing how many great ideas are not being funded. So my job is to try and increase the funding envelope for medical research and for patient support groups. But there is always a lot of pressure on government because there are many voices calling for more funding, and persistence does pay, particularly respectful persistence. So please be respectful, and I know that you are, but it's amazing how respectful persistence does pay. It can feel thankless, and I know many of you will be doing it in a voluntary capacity, and I know medical researchers themselves often do things in a very voluntary capacity. I know my roles as medical advisory on hemochromatosis or eosinophilic esophagitis was definitely honorary, so it was done in my own time. But many of you will be doing this in your own time, either in addition to being a carer or in addition to having paid employment. It does sometimes feel thankless, but it is the glue in the system that keeps the system focused. It keeps the patient voice in front of government and those who are providing funding. But do realise that your voice is incredibly powerful, and that by coming together, as you are doing as a national patient organisation network, that provides the people power that is very, very powerful to government. So congratulations for bringing this conference together. It's been under difficult circumstances, I know. It's a great honour to be here launching the conference today. I know it'll be a wonderful series of speakers that you've got coming up. And congratulations to all that you are doing. You are making a difference. Your voice is being heard. There's so much more to do, but I do congratulate the work that you have already done. And I will be a continued ambassador and fighter for the sector, because what you do is important, and I'd like to be able to help in any way that I can. So thank you very much, and congratulations on the conference this morning.
Thank you so much, Katie. We really value your presentation. Loved the comment regarding respectful persistence, and we certainly will do that. I just wish to ask our organisers whether we've got time for a couple of questions right now. Could someone please just indicate whether you're happy for a couple of questions to be asked of Katie, or whether you'd like me to go on to the next speaker, because we've got about a minute.
Thanks, Anne. Maybe just jump to the question 3 and then we can go to the next speaker.
No worries, thank you. Just give me 2 seconds. So, Katie, how do you think the health system would function if health charities and patient groups actually didn't exist?
Very good question, Anne. Thank you. Look, there's absolutely no doubt that the healthcare system is based on so many individual experiences and perspectives. And I absolutely believe that if we didn't have these patient support groups and the patient voice, we would get a vanilla response from government. And we heard that in the committee inquiry. There's not one pathway, there's not one experience. So what the patient voice does, and what your organisations individually and collectively do, is they bring that diversity of thought and experience to the table, which provides for an inclusive and caring sector. So what you do is you give heart to the head. Government provides the heads and the hands, but patient voice provides the heart. And it would not be worth being alive without having all three. You need heart, hands, and head, heart, head, and hands. And we do the head and the hands, but you have the heart. So without that, it would be a very, I think, lonely sort of healthcare system. And so I think what you do is so incredibly important.
Oh, thank you, Katie. For those of us who've been around a long time, hearing government say that the patient voice is at the heart and doing something about it is truly comforting. We've been fighting for this for a very, very long time. And, you know, it's just so critical that the voice of the patient is heard right throughout every aspect of the healthcare system. So we congratulate government on the achievements and also the outcomes of the Zimmerman report. And we look forward to working with you patiently, persistently and respectfully in the years to come. So thank you, Dr. Katie Allen, for joining us and launching the conference today. Much appreciated.